My name is Thembi Arries. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative. Welcome to Kobecha. We are back again today, and our topic is on epilepsy. That means seizures. And I hope you'll find it quite intriguing. And those that may be having questions, or even people that are suffering from seizures, I'm hoping that we'll leave you with some answers today, or some clarity. So enjoy the show.
Hi viewers, my name is Lorica. We are back again this week with another exciting and interesting topic. We're discussing over epilepsy, and as usual, I'm going to ask my questions, and then Thembi will answer on my questions. Thank you.
Before we proceed with the show, I've prepared this clip for you on epilepsy.
Our bodies are made up of electricity, which regulates communication between cells. When that communication is disturbed by whatever the cause, it triggers an electric abnormality, which manifests as seizures.
Of course I will. Do you have any questions?
Yes. What happens if the alarm goes off? Jen?
Oh, hold on a sec. I think she's having a seizure.
What? Is she okay? Should I go get the teacher?
No, this is... The object of this mission is to go as far into the earth as possible. The alarm means nothing.
There are different types of epilepsy, which are triggered by disturbances in different brain lobes. We are going to focus on temporal lobe epilepsy.
Welcome back. Many people are actually suffering from epilepsy without realizing that that is the case. Where am I getting this? It's because of the experience that I've had with quite a few people actually who are suffering from epilepsy, particularly those that happen at night, what we call temporal lobe epilepsy. So it is for that reason, therefore, that I've decided to focus on temporal lobe epilepsy. Because as the clip shows, we've got different types of epilepsy which are triggered in different lobes of the brain. But I've selected to talk about temporal lobe because that's the one that I find to be quite dangerous. Why? Because firstly, it happens at night, and a person may be sleeping alone, or even if he's not sleeping alone, may not realize that these are epileptic seizures. And also because they are so subtle, you may not realize that it is seizures. And the problem is these seizures, when you keep on having them, the area of abnormality keeps expanding. So you find it was small, but then it ends up becoming more and more severe up until you can actually notice it. So it's for that reason, therefore, that I am focusing on temporal lobe epilepsy. As usual, Lorica is going to be helping with the questions.
Okay, thank you, Thembi. Shall we start by getting an example of someone with seizures who was not aware is having them?
Mm-hmm. Actually, the majority of people that I've treated who have got temporal lobe epilepsy are not aware. Yeah, I'm just going to give one example, but I just want to touch on that, such that I normally advise them, because those that are staying alone, I normally advise them to get the app. I don't know, I've never tested that app. I know there is an app that records you while you are sleeping. Okay, so I don't know how good it captures the whatever's happening during the night. Maybe there's also some maybe it will see other things that you don't want to see, maybe a ghost or something that you don't want to see. So maybe some people may not be keen on but on a serious note, seriously, I would advise people who stay alone to have this app, but not just everybody. But once you start having situations where when you get up in the morning, you're tired, or you're having a headache, and it's a persistent thing that you find every day you wake up in the morning, you are having a headache, or you are exhausted, as though you were doing something, or you are irritable, or you just want no one to talk to you or whatever. Once you have certain telltale signs of being a bad morning person, because I know there are people that are saying, I'm not a morning person, but they cannot explain why are they like that? Why do they wake up feeling so irritable? So once you have that, and the people that you stay with, your husband or your wife, does not tell you that there are certain things that you do at night, because those people will find they either punching you, maybe it may be the wife who's disgruntled and you think is punching you because she's getting even, or something like that. So it may be someone, because there are those that will tell me that no one wants to sleep with me because batting yashayana, at night. And others, they talk at night, and others, so you'll find that there are certain things that a person who sleeps with you will say you are doing. But if you sleep alone, you don't know, because you can't tell, but you can only relate to the fact that you get irritable or headaches or whatever. So those are the things that I would like people to look at, because it doesn't mean when that is happening, it always is the case. But you may very well be sitting with epileptic seizures that are temporal lobe epilepsy, and you are not aware. But now to come back to your question, to give an example. Like I say, I've got lots of examples, but I think the one that might actually be more intriguing is this one, because it's a student. Okay, this is a student who is staying in the residential, section of the university, and she's a client of mine. So I'm treating her for among the things that I'm treating her for is depression. She's a known person with depression. Okay, is on treatment even in the institution at university. She is known to be a person with, bipolar and depression, such that sometimes when it gets really bad, she will get a report from the psychiatrist to say she can skip the test or the exam, and then she can write at a later stage. So she's on she's on chronic medication for depression. So I'm treating her. Okay, but limiting the discussion or her situation to just the epileptic part, the epilepsy part. So I asked her because I picked up that she's actually having seizures at night. So then I asked her if she gets restless at night, or maybe when she gets up in the morning, headaches, all these things and she says no, she doesn't experience any of that. I remember when I was giving her the results, I asked the mother, because the mother could not be with her, so we were doing a online, yeah. So the mother was participating online. So and then I asked her if sometimes when she gets up, she will feel exhausted, And then she says she has had episodes of feeling very tired. But the one thing that she noted, which stood out, was the fact that when she woke up once, in the middle of the night, she felt paralyzed, as if something was totally arresting her and not giving her a chance of moving at all, like a nightmare. But she said it was not the type where you are having a nightmare in your sleep. She was conscious that when she woke up, she was paralyzed. She could not even move the finger. And it was, she stood for a short, good few minutes, feeling like that, like totally paralyzed. And then later on, after a couple of minutes, then she could move the fingers and then the body, but then that scared her. That really shocked her. So when it happened for the second time, she told the mother. So when we were doing this consultation with her, then she said, "You remember, Mama, when I told you about this particular thing?" And apparently, so then they thought maybe it was a spiritual attack or something. So the mother advised her to do some certain things like salt, and all, sprinkle salt and whatever, because they were convinced that it was an attack. So, but she was managed. Maybe she was strong enough to wake up from that attack. So it was then that she could put one and one together because of that particular experience. But she never knew. She never, not once, thought it would have been a seizure. Because remember, when you're having these type, you're not convulsing. Of course, I don't know in her case when she woke up, because remember, when people have had a seizure, some of them, they feel like that. They just feel blocked. Then they, they can't move, they can't. So she probably had come out of a big one, so that's why she felt that type of paralysis, So this was the case. And now imagine, epilepsy is dangerous. So it does, when you have a serious seizure at night, you're staying alone, you have a serious seizure at night, and it keeps recurring. You could actually die from that. Yes. So it's treated as an emergency. Even in hospital, those people that are having known seizures, when they get a seizure, it falls under emergency. You won't go to POC. You will go straight to the consulting room, because they must give you something to stabilize. Otherwise, it's dangerous for the brain. Okay, so that's the example that I can give, which even in this case of depressive episodes that she was having. Because like I say, you must remember temporal lobe epilepsy happens at night, and it is because of the abnormality that's occurring in your temporal lobes. Now, temporal lobes are responsible for a range of functions. Your emotions are sitting there, are regulated there. Your auditory functions, they are information, they are regulated there. Your facial recognition, like for instance, there are people, I remember even when we were filming, last week, and one of the guys here who are filming, and then they're saying, I would have an episode where I would like see someone and I say, I've seen this person before, but you cannot tell, where did you see that person? That's deja vu. Now, deja vu occurs, it's an episode, it's an after math, it's a post epileptic manifestation. So where you find a person says, someone say, I've been here. I'm convinced I've been here before. Meanwhile, they've never been there before. Or I know this person, I know this person. So you don't know the person, you've never seen the person. But because temporal lobe has one of the functions is recognition of the face. So the distortion of the information will say, you know this person, you recognize it. Meanwhile, you don't. Okay. So what I'm saying, therefore, is that even the depressive episodes that she was having were actually linked to the temporal lobe, because that's another function that is regulated there. So that that's the example that I can give. Otherwise, I've got a range of examples.
How do you make people believe you when you tell them they are having seizures, such a complex condition?
Particularly that I'm not a conventional doctor. Because that would be like, are you serious? No, serious. It's only that people have learned to really have confidence in my diagnosis. And I think it's because of the years of experience of working with me, and also because when I tell you, like this, for instance, example that I gave you, when I tell you that, or ask you, are you not experiencing something of this nature? And you actually can relate to that. So how would I know? It's because I give people something that makes sense to them, that explains the manifestation or the symptom that they are having, which they probably did not give attention to, or just ignored it because they thought it's just like this example. Because this is an example that the person is aware of, and it frightened her. She told the mother, and the mother said, take salt. They gave an explanation to the symptom, but they did not link it to epilepsy. So when I say it's epilepsy, and I make you relate to a range of events that have happened before, which you never linked to this, you're bound to listen. Yeah, you are definitely bound to listen. So it's so in all the cases. Now remember, this type of temporal lobe epilepsy, even in cases of children with autism, children that come to me that are already having a label of autism, where the parents are not aware that these children are having seizures at night. And I tell them. Then you find initially they will, no, like when you say, because when I tell you, I don't say, I tell you, I will tell you that this child is actually having a seizure. It's not like I'm asking, doesn't this child have a seizure at night? I tell you that this child is having a seizure at night, even though you're not aware as a parent. But then when I tell a range of things that is likely to be happening, then you find the person, it's not, I don't find it difficult to convince people, or to not even to convince, to tell people and for them to buy into my diagnosis. Because when I say, I don't just throw and say, your child is having a seizure, I will say, because of this and this and this, why this child is having a seizure and how it is manifesting. I remember one particular parent who I had diagnosed that the child was having a seizure. And she said, no. And I said, he's having a seizure. When I treat him, I'm going to give him treatment for epilepsy as well. And I said, when he starts with this treatment, he's actually going to trigger, he's going to poke the bear again, because he's having the seizure that is not being treated. now that we treat it, and that's what the brain does. When you treat the seizure that's been ignored all this time, you'll find it's going to register its presence.
It's true.
So then I tell her that when this child, when I treat this epilepsy, that brain is going to, it's like a wild horse, that when you start training it, it's going to throw you down, up until the horse is tame. So I said, that's what's going to happen. That's exactly what happened. The child got a seizure in the bus. He had never shown to have a seizure. But the interesting thing that happened in this particular case is that when I told the mother that this child has seizures at night, she only told me when the child was having a seizure in the bus. She never told me during that time that he did have a seizure some years back, or I don't know how far back. And he was given Epilam, to treat it. But then she never administered that medication because the child never showed signs of seizures again. Meanwhile, this child is having seizures at night, but because she can't see him convulsing, so she thinks the child is not having them. So now when I start treating them, and then the child had seizures in the bus, school bus, and they took him to hospital. And then only then did they tell me that this child was sitting with Epilepsy at home, which he had been given some time back. But then they managed to, after a struggle in the hospital, to tame him because the child was just going. So then they managed to tame him. They gave me some medication, and then when he came back home, so she wanted to know how does she move forward. So then they gave him 2 types of medication. So, and I advised her on how she must administer that. I said, stop this one of mine, take these 2, but the one that they say take little of, take more. And the one that they say take more, take a little. And then the child was stable, was fine, never had convulsions again. And then I said, after a few days, you must start administering mine as well, but remove this one, add mine. And then the child was fine. And then I said, you must just monitor. And then she said, no, he never had any issues after that. And then after a while, I think after a month or whatever, then she called. She was not calling me about this, but I was just checking how's the child doing and all that, because I kept on adding medication, not for seizures, but for other things that he came to see me for, that I diagnosed. And one of those was the hands that she said they were yellow before I gave her them, and they had accepted that they don't know, the doctors could not clear that yellow color on the hands and the feet. So she was just fascinated now that coloration had totally cleared. So she was giving me a feedback. And then she says, the other thing that the child is doing recently is he giggles a lot at night. He will, she says he giggles. I say he's having seizures when he's giggling like that. He's having gelastic seizures, They make those ones, you don't convulse, but you laugh. It's like ticklish. I said he's having seizures. So I also changed the medication again. I upped the dose, and all that. And then he was fine. He never had those seizures again. So what I'm saying, therefore, is that people believe me because I don't just throw a diagnosis. I explain and I give all the things that you're relating to, which are confirming my diagnosis. Let's go for a break. When we come back, we continue with the discussion.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adenylase enzyme deficiency. Diseases including tissue cancer,
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in like the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat?
Welcome back. We are talking about epilepsy, which particularly the one that is temporal lobe epilepsy, which affects these lobes that are on the sides. Okay. So when we went to a break, I was giving an example about this child who had scholastic seizures. But before you continue with your questions, Lorica, I just want to point out this. I once had a lady, a young lady, married. She was married, and she said, she doesn't know if there's anything wrong with her husband because she was newly married to this guy. And she said she doesn't know if there's anything wrong with the husband because when they're having sexual intercourse, when he climaxes, he will giggle. She says he will laugh, and I will look at him, and he's just. And she says he's not even conscious of me looking at him. He's just laughing. So now she had come for herself, but now she thought she must just check with me because this is now weird. She was not saying he's sick or anything, but she was saying it's weird. Maybe I can give some explanations to this. I said you must actually ask him to come and see me because even in a case like that, there are people who, when they climax, they actually get a seizure. Okay, so scholastic seizure is one of those where they will laugh, but others will just really have convulsions. Because that's when the brain is triggered, is overstimulated, and it triggers electric abnormality.
Yeah.
Then you will find but of course she never brought him. Of course, how would she? Because what is she gonna say? Why is she bringing him to me? Because in her case, she had her issues, but now the husband, there are no issues. It's only this giggling. so she never brought him. So I can't really tell if it was, but I did indicate to her that it may very well be that he's actually getting a scholastic seizure at that time. But anyway, it just occurred to me now.
Okay, thank you, Thembi. So now I want to ask, how dangerous is epilepsy?
That's dangerous. It actually is really dangerous. What happens with epilepsy is that when you get a seizure, it may just be a very teeny-weeny area in the brain that is where there's electric abnormality, but when you get when the treatment stops the seizures, then you find it's okay, But when you get a recurring, because remember, when you're having that seizure, even the oxygen supply is interfered with, is diminished. So because you stiff, So, and the more, the longer, because some people who are in serious epileptic, levels, you will find that they will have recurring ones, one after the other, So that's why you find they have to be rushed to hospital because the brain gets damaged. That cell, that particular area, you find it gets damaged. So it may cause the brain damage. That's why you find people that are epileptic, they will be, as the epilepsy keeps going and it's progressing, then you find there is some cognitive decline. You can see something is not right, because those cells get damaged. because that's an abnormality, So it's dangerous. It might actually even kill you, because if you're getting the seizure in an area where maybe you're alone and you're getting those big ones, at least the small ones where you come back, like petit mal seizures, it's, but those grand mal, which are serious ones, if you get recurring and there's no one who's with you who can see you having a seizure, you could actually die from that attack. But not only is it dangerous in terms of the brain, when it's dangerous because if it hits you and you're not aware that you're having it, you might have very well have it at that, maybe you're driving or you cooking or you're doing something, and because it doesn't, in some cases it will warn you. There are people where you find when they're going to have a seizure, maybe they will lick the lips, or they will blink, or they will say they're smelling something, or the senses tend to become overstimulated. Then if you're staying with people that know you're having this, then they know. Then they will take the necessary steps. But when you're alone and you keep having this, and then it keeps getting worse and worse and worse, and you are not aware you are having a seizure. So you are so much exposed, it's actually really scary.
Yeah,
So it is a dangerous condition because it has got the potential of damaging the brain. So it's a dangerous condition.
Okay, thank you.
Mm-hmm.
What have you found to be the cause of the cases you have treated?
Okay, now for those cases, in cases of children, for instance, those children that are autistic, what I've found quite common is children who have got what is called mucolipidosis. Now, mucolipidosis is a condition that actually disturbs the metabolism of the lipids, because you're lacking a particular enzyme that is a precursor that guides where protein should go in a cell and where fats should remain. But now, because you've got this defective gene, because you're lacking this particular enzyme, then you find that those fat structures will just accumulate instead of being spread out because they are properly metabolized. Then you'll find they will accumulate in a particular area. So now when they accumulate in the carotids, which are the arteries that sends blood to the temporal lobes, then that's what I've found, that the mucolipidosis is the number one that I've found in children who are autistic. But also in adults, there are adults that are found. There's someone that I saw recently who I saw is having mucolipidosis, and is actually having seizures. He was also one of those where he's not aware that he's having seizures. But the other thing that I've found to be quite common is fructose intolerance, aldolase C deficiency. Now remember, aldolase enzyme is an enzyme that processes fructose sugar, and fructose, and it is stored in three places. Aldolase A is stored in the tissues, aldolase B in the liver, and aldolase C in the brain. So those people that are fructose intolerant, who are lacking, and that means lacking the aldolase enzyme. So when it focuses on the brain because of aldolase C, I've found it to be one of the causes that cause epileptic seizures, night seizures, temporal lobe epilepsy. But also anything and everything that clogs the arteries, the carotid arteries, because those are the arteries that are servicing, that are pumping to the temporal lobes. So anything, it doesn't necessarily have to be fructose intolerance. It may be calcium, it may be cholesterol, it may be a lipoma, it may be anything that is clogging those arteries, and then it will cause, temporal lobe epilepsy. one that I found really intriguing, which I found in one of the children that was brought to me by the parents. Actually, they came with the mother and father, but the father was not in when I gave this diagnosis. And this child had a fibromuscular dysplasia. It's actually a condition that attacks the arteries, and it affects the carotid quite a lot, and it kind of twists them, and either it will make them cling together, or it will twist them and make them not to be able to supply blood to the brain, or it may make them bulge, because in this particular case, this child, so I tell the mother that this is, and it was my first case of fibromuscular, dysplasia. So I tell the mother, this child has got this condition. And she says to me, you are actually answering a question that I've asked the pediatrician for how long, because this child has got bulginess that is occurring behind the ear. And it's not pain, when you press on it, it's not like it's painful, but it's so conspicuous that it concerns me. So I've asked but then it would say, sometimes it would look as though it's getting smaller, but in other times it would look like, but it's there, it's sitting there. So, but when she brought the child to me, you could know it was not visible on the outside, but I could see in the scan that this child is having this, and it's affecting the one side of the carotids. So, and then she actually cried. She actually cried, and what made her cry was the fact that she got an answer to something that had been bothering her, but which nobody could relate to, because as a mother, she knew something is not right. But she was not bringing the child for that, she was bringing it for autism. Okay. So and then she said, can I bring my husband? But the husband, he was sitting with the child while I was giving. So now they took turns, so I bring the husband. Okay. So then I'm sharing this with the husband, and then the husband is asking me the specific. Of course, I did explain to them then. To him the same thing I told the mother. Now he wanted to know in the genes, because it's the particular. Because I could see that he was trying so hard to try and dispute my diagnosis. He was trying so hard to dispute my diagnosis. He just did not buy into it, So while the mother was blown, the father, so which takes me back to your second question where you ask, how do you convince people? How do you make people believe you? Mm. Well, it was just one odd case where I found, really now, So I said, I'm not going to waste time nitpicking, and focusing on the genealogy, and I'm not going to do that. I said I'm not doing that. So you can go, and I've told you the type of condition that's happening. So you can just go and do your own research, do your own Googling or whatever material you're going to consult. But this is what is and it's a very, and that type of condition, it's actually it's a fatal one. Yeah. Because once those arteries, because it doesn't just affect the carotids, it attacks the arteries. It may be the renal ones, it may be the arteries that are just servicing the body throughout. So it's a fatal one. It's actually fatal, So if it's, fortunately, they never came back for me to treat, because, and I know it was because of him. But anyway, what I'm getting at is there are so many things that I detect in this work of mine, which explained so many things, including that epilepsy.
Okay. Thembi, is epilepsy a reversible condition?
Yeah. It is a reversible condition depending on how extensive the damage has been.
Okay.
There are people that you find have been, I mean, I know that in our culture, they say if you've got, I mean, it's one of those old tales, you know, of the Makulus, where they say, if you've got a child or a person that suffers from epilepsy, make sure that they don't fall on fire. Because if they fall, they get if they get a seizure while maybe busy with, and they fall on fire, they're never gonna get out of that. I mean, there's that belief. I don't know, I mean, that's yeah, I mean, that's yeah, it's one of those Makulu tales. So it's just to make sure, and I think it's actually a smart one, because it's to make sure, because of course when you are careless and the child or the person works with fire, and I mean that, let alone that is never gonna get off, you are exposing to so much danger, because that person is gonna burn.
Of course.
So it's actually a smart, because some of these old tales you find they were just smart warnings, not necessarily meaning there's something that actually happens because of that fire. Okay. But now this is the thing that with epilepsy is I've reversed it.
Okay.
I've reversed it. I mean, seriously, I've reversed it. I've spoken about a number of cases here, but you've got to know what is causing that epilepsy. But in cases where you find that it has progressed so much, because remember, when you get an episode of a seizure, the damage is getting done. You get another one. The damage is getting done. So what happens is that the area that was affected may be a teeny-weeny one, but each time you get, it keeps expanding. It's just like when they say a stitch in time saves 9. That once that stitch, you have not done good work to make sure it doesn't. It's gonna up until you can't. So even with epilepsy, it's like that. That there are people that you find that it may affect one side of the brain, your temporal lobe. But because it is so recurring and you cannot control it, then you find it ends up getting to the other side. And you know what they normally do in conventional medicine is that there is a connecting a tissue that is called corpus callosum, which connects the two hemispheres. So what they do is they will just sever, destroy the connection between the two lobes when they see they cannot control the progression of those seizures. You're just having them. And then they realize it's going to expand to the other lobe. Then they will just sever that, remove that connection. Then you find that creates a problem of a different kind, because these hemispheres, they must communicate, they talk. So, and then you find people like that, when you show them, maybe you say you show them a pen. They see it's a pen, but maybe they will say it's a glass, because now there is no connection between the two hemispheres. This one sees it as a pen, but then the language, the link of the recognition of this with the language is something. So you find they will say it's this and they will mean something else. There's actually what is called aphasia, in the brain. So that's then what happens. So it's very important to know that it's something that can be reversed. But when the damage is too extensive, but even when it is that, you can still stop the seizure, but maybe you cannot reverse the damage if it's too extensive, that is to the brain. I've had a case that I once shared, which this person was brought to me when he was 30, but he was having a seizure since he was 3 years. And they could not control the seizures. So, and when this professor saw this case, he was intrigued and he put him under his wing for 8 solid years. He was studying this child, studying this brain. This is a neurosurgeon. Because what was intriguing was that he is having seizures, but the EEG readings are not showing any abnormality, any electromagnetic, EEG abnormality. So how is that? Because even while he's having a seizure in hospital, because they kept him in hospital, and whenever then he would be called, then he would watch him, and then they would connect to, but there was no reading. The brain would just be normal. How's that? So they tried for 8 years, but the brain was getting damaged because this child was having seizures. So when the mother brought him to me, he was 30. But in his case, the problem was coming from the pancreas. He had insulinoma. He had huge insulinoma, which were chowing all the sugar, in the body, and were triggering those seizures. Okay. So people who are also having insulinoma, there are those who are having seizures, but who are not aware they're having seizures because of insulin. Because insulinoma will just chow the sugar, and that brain needs the sugar. Other organs, they need the sugar. So then the brain goes into a shock, you get a seizure and all that. So we managed to stop the seizures, totally stop the seizures, because we treated those insulinomas, shrunk those insulinomas, so sugar was no longer an issue. But the damage to the brain was still extensive. So there was a lot of work that needed to be done on the brain itself to try and repair those cells, and it's costly and all that. So I did work with that child to a great extent. And I remember the mother saying, this professor was so fascinated when he saw that he stopped. He actually offered him a job in his office or something. Wow. And I think it was for him to be able to observe him, to see how he was still studying him, even though it didn't appear like that. He had just offered him a job and he was paying him for that. Of course, the job, because the brain had been damaged. So he was not like intellectually there, but he was functional. So he could still, this is a glass, pour water, and he must remove. So he was doing those type of functions. But he was working for this professor, which was kind of really interesting for me, So that's where we're going to end our show today. But as I've said when I opened, you may be sitting with seizures that are taking you at night, and because they are mild, or you don't behave in a way that you're punching people or you're having convulsions, you may not realize that you're actually having seizures. So if you do have such situations, or someone that is related to you is having that, you must please bring them to me, because I'll be able to tell you if they are having seizures, whether they are having them because of what. So I hope this gives some light to you, our viewers. Thank you for watching, and goodbye.
Thank you, viewers, for tuning in today. I hope the questions was relevant and the answers was clarified. Thank you.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adenylase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.